everyone. I feel very privileged to be part of the South Asian Heritage Month. I'm Sam and I specialise in brain injury and I trained as a speech and language therapist. It's our job to help people who have trouble understanding, can't talk, can't communicate, can't eat and drink, often because of different brain injuries such as stroke, head injury and dementia. Of course, we're not only helping the person with the brain injury, it's also very difficult for their loved ones who do not understand what is happening and feel extremely lost. I do what I do because I know that we can help transform people from literally being trapped to living a better life. The satisfaction they experience and the joy their families often go through can be truly heartwarming. To bring this to life, let me introduce Nazia. She is someone who has had a brain injury, and when I met her, she could only say a few words. She's going to talk to you, and you will be able to see just how far she has come. What's more, she now volunteers for South Asian Heritage, who, having seen what is possible, she kindly asked if I could come and speak to you all today, with the aim of raising awareness of speech and language therapy to see how we can best support your community with both communication and eating and drinking, particularly in relation to well-being and mental health. Thank you, Nazia.
Oh, thanks, Sam, and hi, everyone. Thank you for joining this session and discussing brain injury. I am volunteering with South Asian Heritage Month, a new organisation launched 2 years before. The aims of this organisation is to better understand the diversity of Britain now through education, culture, arts, history, sports, and health and well-being. It runs in 18th July to 17th August every year. So in April, the co-founder, Benita, requested me to create activity about health and disability. My instinct was to say no. I shied away from the word disability, and my speech was improving, but it was not the same before. I realized afterwards that my speech disorder is a hidden disability. And what if those who have similarly issues, Asian or non-Asians, cannot communicate, not eat, not drink, and they cannot seek help? South Asian Heritage Month is really to raise awareness through people who have stories, and for me, attract new generations of speech language therapists, especially male therapists. So can I also, I'm now joined with Josh, and Josh will speak to his, sorry, it's Sam, please.
Thank you, Nazia. We thought it would be good to give you a little bit of information to show you how speech and language therapy might be able to help your family and friends. I had no desire to stop seeing patients progressing during the COVID lockdowns. We were very aware that people were extremely isolated as their treatment had been disrupted, and we wanted to help. People were unable to speak to other people. They couldn't just pick up their telephone and make a call. We adapted very quickly and moved from working with patients mainly face-to-face to face-to-screen via Zoom. One particular highlight of the past year was the communication cafe we set up. It's a supervised, safe and friendly online meeting place for people all over the country with communication difficulties as a result of a brain injury to keep practicing and improving. Attendees are able to practice speaking and interacting with a broader group, something which became especially difficult during the lockdowns. We continue to run the cafe, even as services start to reopen, which has been so special. It means that people had a purpose. They can practice skills most of us take for granted, like talking, which of course has huge benefits for their confidence, especially when talking to their friends and family. If I can introduce you to Josh, who will tell you a bit about the cafe and the way that it helped him and others cope during lockdown, and why so many people have continued to come to the cafe since society has started to reopen. Thank you, Josh.
Thank you, Sam, and thank you for this opportunity. Communication can take various different forms. I was very aware that my facial expressions did not always match with the sentiment of what I was saying verbally. Therefore, I discussed this with Sam, and with the help of an organization called ARCOS, a bespoke program was developed. Several months later, we were in lockdown. I had made great progress, and I was aware that I would lose my newly found skills if I did not use them. Then I would be back at square one all over again. When Sam and I first discussed the bespoke ARCOS program, we always had this unresolved issue in the back of our minds. Once I had a grasp of using individual facial muscles, how could I practice them in a real life situation? Then Sam came up with a communication cafe, which was the answer, enabling cafe goers to practice in a safe and supportive environment. All the cafe goers have some form of communication difficulty. We all need to practice in a safe environment. By coming together in the cafe, we were all working towards our own goals whilst helping each other. This cafe has enabled me to continue developing my facial muscles whilst being a great place to meet a new set of friends. Now back to Sam.
Thank you, Josh. Since restrictions eased, we've continued with our face-to-screen time, but we can also now start helping people face-to-face again. Let us now introduce some of the ways speech and language therapists can help you if you or your family can no longer talk, understand, read or write, or have difficulties with eating and drinking. Elizabeth and Sarah from our team will start us off. Thank you, Elizabeth.
Thanks, Sam. So part of a speech and language therapist's role is working with those who have difficulties expressing themselves and communicating with others around them. Communication is such a fundamental part of who we are and how we interact with others. And when people lose this ability to communicate or it's impaired in some way, the impact on a person's identity and life can be huge. Communication may mean speaking, but it can also mean understanding what someone says to you, reading, writing, and using non-verbal communication, such as gestures and facial expressions. Adults may need support with their communication for a wide range of reasons. These can include after having a sudden brain injury, such as a stroke or being in a road traffic accident. For others, it may be due to a longer-term condition, such as dementia and motor neuron disease. Children can also benefit from support with their communication skills. For example, if they have a language delay, difficulties with speech sounds, autism, or another difficulty with social skills and attention skills. Speech therapists also work with both children and adults who have a stammer. So communication difficulties can range from being mild to severe and can affect anyone, either suddenly or over time. As speech and language therapists, we combine our medical knowledge with our knowledge of how we communicate as humans, and we'll try and work really closely with clients and their families to ensure that we give the best and most personalised support that we can. We find it's really beneficial for clients' mental well-being to acknowledge these difficulties and then to find ways to support the person to participate as much as possible in family life and activities that they enjoy. And Sarah is now going to give us some more details about types of difficulties that we work with and also give a few client examples.
Thanks, Elizabeth. So the support we give often varies because we try and make our therapy and assessment as individualistic as possible. But just to get a better idea, our therapy can include things like supporting people to speak a bit more or communicate even better. And that's not just limited to speech, but also using devices, books, or nonverbal communication. We can also work on word finding difficulties, and that's almost where the patient can see the word in their head. It just can't quite come out their mouth, and it can be really frustrating. We also work on supporting others with what to say, and helping others and helping them understand those around them so that they can access conversations such as with their loved ones and on the dining table, for example. This can also include things like communication partner therapy, where we work really closely with, for example, their spouse or their relative, and this can really help quality of life. We can also work on their interests, such as their hobbies, and help them participate in the activities that they were doing before their accident. So we also have patients who have cognitive communication impairments, and I feel that these patients are often the ones that are overlooked, as it's a lot harder to recognize. They may present with socially inappropriate responses, providing verbose, tangential, or egocentric responses. They may have a lack of facial expression or being unable to maintain a conversation. But therapy here would include things like education, such as brain education, as they're often unaware of the impairment that they have. So we try and give them brain education to show them the effect that it can have, how normal it is to have this impact, and hopefully that will cause some motivation for their therapy. This can then be through video feedback, where we can help them realize the new behaviors that they're presenting with. We can create specific personalized goals for clients that are relevant to their daily lives and focus on what they would like to target. So just to give some examples, we've had clients who've had a stroke and they've been very limited in their spoken words that they can say, and this is often called expressive aphasia. Between them, they want to work on being able to do things that we all do, such as requesting items, ordering a meal at their favorite restaurant, where they want to go with their family, asking their friends and family how they are, what's been happening, or just wanting support in their workplace. We've had clients whose spoken language is perfect and completely intact, but they find it really difficult to understand what others are saying to them. So we've looked at their understanding of keywords and strategies that they can use to help understand what they're being told. We've also had clients who want to work on writing grammatically correct text messages to their friends. Although these are just some examples, I hope this gives you a better insight into what we do for communication. But now we're going to hear from Nazia and Josh around their personal insights within the field of speech and language therapy. So over to you, Nazia.
Great, thank you. So insights. So I started with Sam 3 years before, after my rehab stint after the hospital. The doctor said to me that at the time that my speech will peak 6 months and that's it. So I think the doctors were really helping me to lead a new reality for me as well. My speech was kind of really, limited as well. At the time, 3 years before, I was really angry. I was really frustrated. I was really impatient to regain my speech. I had 4 or 5 words and that's it. And one was a swear word as well, you know. And also my writing skills were kind of lost or limited as well. I needed motivation to practice every day for my speech. I need to call my family and friends. And my confidence was really, really zero. So Sam and later Sarah, where they really believed me that I will regain my speech as well. They really practiced with me all the time for like 3 years. And for me, though my fluency is really baseline, I'm more confident as well. So for me, speech language therapy is really essential for me as well. It's been like 3 years now. So I think for now, I think it's kind of really like wonderful for me as well. So I'll go to Josh now.
Thank you, Nazir. 4 years ago, my swallow deteriorated, which meant that every time I would eat or drink, I would probably choke. As you can imagine, this was horrible and very distressing for my family and me. I discussed my difficulties with Sam, and we discovered that I needed a slightly modified diet and fitness when I was drinking. We went through my diet and selected what I could eat safely, and then what medium or high risk foods I should avoid when I was tired and fatigued. This enabled me to eat and drink safely and know what foods I should be cautious around and what foods to avoid entirely. Thank you very much.
Thank you, Nazia and Josh. Something that most of us love doing, it's built into our daily lives and is a highlight of a lot of social occasions, is eating and drinking. It's of course also what keeps us alive. However, a common symptom of brain injury is that people struggle to swallow. This not only deprives people of their enjoyment we all take for granted, but can also be life-threatening. To bring this to life, Zara is going to talk to us about how we go about helping people who have dysphagia, the medical term for swallowing difficulties, even the most severe. Over to you, Zara.
Hi everybody, my name is Zara and I'm a speech and language therapist. I'll be talking to you today about dysphagia and dysphagia management. Dysphagia is a really important part of a speech and language therapist's role, and that's kind of what we'll be going through today. So dysphagia basically means a difficulty swallowing, and it can be caused by a difficulty in any of the 3 phases of swallowing, which includes the oral stage, the pharyngeal stage, or the esophageal phase. The oropharyngeal part is the part where speech and language therapists will be able to help. The esophageal part is managed by doctors. So oropharyngeal dysphagia can be caused by many things, such as a neurological cause like a stroke, a traumatic brain injury, dementia, Parkinson's, MND, MS. You can have a respiratory condition like COPD or lung cancer, or even something like COVID. A developmental condition like a learning difficulty or cerebral palsy, and there are other causes of oropharyngeal dysphagia. You can get it with age-related changes, intubation, tracheostomy, other medical conditions like sepsis, and also head and neck cancer. With dysphagia, what we want to avoid is aspiration or choking. So aspiration is when material passes below the vocal folds and you get a reaction from it. So material will pass below the vocal folds and normally you will cough, but in some patients there will be no reaction, and that's called silent aspiration. Choking is when the material completely blocks the airway and you're prevented from breathing. There's a picture on the slideshow which shows some food and drink that's gone into the lung and then some food and drink that's gone into the stomach. And we obviously want food and drink to go into the stomach and we want to avoid it going into the lungs. So in order to prevent food and drink going in the lungs, there are a few things that we can do. We can modify diet and fluids. So for example, some people with dysphagia will find it easier to manage something like a puree diet where their food is completely smooth. And we also use something called thickener, which we put into drinks. And there is a theory that if you drink a thicker drink, it will pass through your throat slower, which means that your muscles have time to coordinate and you have time to kind of close off your lung tube and open your stomach tube so your food and drink can go into your stomach safely. We can also try doing environmental changes. So often we find that if we sit people upright fully, we make sure that they're in a chair, then that can help quite a lot. And things like reducing distractions for patients with dementia, that can often help. So we'll try and do those types of things first. In the slide before, you saw an image from what we call a video fluoroscopy. If we're unsure about somebody's dysphagia, or we're not sure whether they can eat and drink safely, we may need a more objective measure. So something like a video fluoroscopy, which is an x-ray of your swallow, or a FEES, which is where we put a camera down to have a look at whether you're safe to eat and drink. And that can sometimes inform our dysphagia management a little bit better. If you've had something like a stroke or you've got a neurological condition, sometimes swallow therapy with certain exercises to aid the muscle movement can help, and we can sometimes do that. If you've had something like intubation or a tracheostomy or even a stroke or something like that, you may introduce food and drink very slowly through what we call oral trials. So you may start with very small amounts of water and then move on to food like yogurt or something very pureed to try and get your swallow muscles working, and then we build it up slowly from there. If we are unable to manage dysphagia through any of these ways, then we may consider what we call non-oral feeding, which is a tube through your nose down to your stomach, or a tube directly into your stomach, which is a longer term non-oral feeding. And we may say that you can eat and drink a little bit alongside having non-oral feeding, just for pleasure. The other thing that's really important to help manage dysphagia is things like mouth care. Mouth care can really reduce your risk of aspiration, so it is very important. Just going to talk a little bit more about non-oral feeding. So if we're unable to manage the risk of aspiration via modifying food and fluids or swallow therapy, you may be offered a longer term option, which is normally put through the stomach. It's a tube and it's often known as a PEG or a RIG tube. And this allows a person to receive all of their nutrition non-orally. This can be really useful if a person's dysphagia is really severe and they can't eat and drink safely. This decision is usually discussed in detail with doctors and families because the operation for a RIG or a PEG poses a great risk and it may not be appropriate for some people. A RIG or a PEG doesn't improve a person's medical status, it will prolong the person's current medical status, but it won't provide any kind of pleasure or improve the safety of their dysphagia. There is other options, and the other option is known as risk acknowledged feeding, and this is when a person has been seen by a speech and language therapist and they're at risk of aspiration, either with all consistencies of oral intake but they're still going to eat and drink, or they're at risk of aspiration with certain consistencies. So maybe they've been advised to have a puree diet and thickened fluids, but they don't want to have that puree diet and thickened fluids. Maybe they don't like it or they don't find it pleasurable. And so they're going to eat and drink normal foods at an accepted risk of aspiration. The decision to risk feed is recorded thoroughly. Again, it's discussed with the doctors or the GP and they are very involved in the decision. And the decision is also discussed with next of kin or family if the patient is unable to be involved in those decisions. Risk feeding allows a person to experience pleasure from eating and drinking, and so it can be quite a nice way, especially if somebody's got a PEG or a RIG alongside eating and drinking. The types of patients that normally risk feed are patients with an irreversible dysphagia because of an underlying condition, so maybe something like dementia or Parkinson's, people that are nearing end of life, people who have capacity and wish to prioritise quality of life, or people who have a PEG or a RIG and wish to have some oral intake for quality of life. So that's kind of the role of a speech and language therapist when it comes to dysphagia. If anybody has any questions, then please feel free to ask. Thank you very much.
Thank you, Zara. Some of the things we've talked about today might resonate with you, and you might find this useful to someone you know. I also wanted to mention that speech and language therapists are medically trained, and it's an incredibly satisfying profession, one that's often overlooked, but which provides a very fulfilling career. Research has shown that one of the biggest barriers to the growth of the profession is that most young people simply don't know about speech and language therapy. We really want to attract a diverse new generation to speech and language therapy. There's so many different areas you can work in, from helping adults with brain injuries, learning disabilities, the young, the old, children in schools, clinics and hospitals. There's no such thing as a typical day for a speech and language therapist. We can work as part of a multidisciplinary team in people's own homes, in schools, within the NHS and the private sector. However, one thing in common is our work to improve the quality of life, well-being and identity for our patients and clients. Whether it's helping an adult who has had a stroke learn to talk again, or helping premature babies with feeding and swallowing problems, speech and language therapists can make a huge difference to the people they work with. Mariam and Mark, can I ask you to tell us a little bit about how and why you decided to work within this field? Thank you, Mariam.
Thank you. My name is Mariam and I'm a student speech and language therapist. I was previously studying radiography. Though it was a valuable profession, I felt the level of patient interaction and management was limited. I currently work part-time at an optician's, and it made me realize that I wanted to be in a profession where I'm able to see my patients' progress from start to finish. I am a bubbly person, so enjoy talking to people and having that face-to-face interaction. As a future speech and language therapist, I will have the ability to change a person's life as I can break the barriers of communication for an individual. I will also have the pleasure of working with people of cultures and religions different to my own. I am enjoying the journey of qualifying to become an SLT and can't wait for what it has in store. Thank you. I will now pass you over to Mark.
Hello, my name's Mark and I am a speech and language therapy assistant. I didn't start out traditionally. I trained in modern languages and linguistics, which is where my interest for language started. Living in France as well and interacting with people that speak different languages and that communicate differently opened up my mind at that point to realize that's something I wanted to do. However, I then chose to run restaurants for 10 years and the interpersonal skills I gained there really paved the way until last year when there was a national lockdown, and it was the 23rd of March 2020 that I sat down and decided I wanted to be a speech and language therapist. Since then, I have done multiple online courses and I applied and have now been in a role in a neurology, mainly in a stroke unit in a hospital, working as a speech and language therapy assistant. And I haven't looked back, I've only looked forward, hopefully to be studying next September a master's, as the interpersonal interchanges between people, facilitating communication and helping people express themselves is one of the most rewarding things I've ever known, and I'm incredibly happy to be involved with it. So thank you very much.
Thank you, Mark.
No
So
problem.
hopefully this has brought to life about the value speech and language therapy has on people's lives. To finish off, I thought it would be nice for Josh and Nazia to say a sentence about what speech and language therapy has meant for them.
Thank you.
Josh.
Thank you, Sam. By working with speech and language therapists, most notably Sam and Elizabeth, I have taken back control of my swallowing and my non-verbal communication. It's devastating when you feel that you are no longer in control of your most basic human needs, such as swallowing. However, it is a truly euphoric feeling once you know when you have made changes, you can get back what you think you have lost. Thank you, and I hand you over to Nazia.
Thank you, Josh. For me, if I had no speech therapy, I would pass the test but fail in life. And I think for me, my final thing is that we need more diverse candidates as well for Asians and also non-Asian community as well. Thank you.
Thank you, Nazia. And thank you everyone for watching today. And goodbye from the team.